Hello everyone, welcome to the another lecture. So today where we are going to discuss about fifth and sixth principle involved in the management of poisoning. So our another principle lies in the antidote administration. So again this is an important principle. So first let's get familiar and introduced with the antidotes. What are antidotes? So these antidotes are the substance which counteract the effect of poison. So which counteract the effect of poison, जो poison के effect को खत्म करते हैं, उसको counter करते हैं, उसको हम क्या बोलते हैं? Antidote. They are known as antidote. So we can classify them into various classes. So let's see one by one. First is the physical antidote. ये क्या करता है? Physically it will go and it will interact with the poison substances and it will inactivate the poison substances by physical mechanism. Example we have given previously also, activated charcoal. What it will do? Physically it will go and it will absorb the poison molecule. It will physically absorb the poison molecule so that now this molecule is not available to do all the hangamas in our body. In that way it is counteracting the effect of poison substances. So this comes under physical antidote. Our second type of antidote is the chemical antidote. What it will do? These chemical antidotes will go to the poison go near to the poison substances. They will react with the poison or harmful substances, and they will change the characters chemically so that these poisons are now not available to do all the nuisance in our body. Now example is the British anti-lewisite, that is BAL, used in the heavy metal poisoning. What it is doing? This British anti-lewisite is going to the heavy metals. Chemically it is binding to the heavy metals. It is chelating them and it is not leaving them free to do all the nuisance in our body. In this way it is counteracting them. It is inactivating the action of the poison substances. So these type of antidotes are known as chemical antidote. Now our third type of antidote are known as physiological antidote. So physiologically in our body, these antidotes will nullify the effect of poison. They will act just in opposite way of the poison. Example, atropine oppose the action of organophosphate poisoning. So in organophosphate poisoning generally क्या होता है ना, these poisons will block the ACHE, acetylcholinesterase enzyme को bind करते हैं, जिसकी वजह से acetylcholine का concentration बढ़ जाता है, क्योंकि ये bind हो जाता है. This concentration will increase. Due to that, the muscarinic receptor and nicotinic receptors activity will get increased. However, this atropine is having just ulta activity. It will reduce the muscarinic, it will reduce the nicotinic activity, which will nullify the effect of this acetylcholine. So this type of action is known as physiological antidote. Now another is the serological antidote. What they will do? They will go and counteract the action of poison substances in the our body. Now example is the anti-snake venom prepared from the serum. Now these antibodies will go to the snake venom. Now this venom will act as a antigen and this ASB will work as an antidote. It will nullify the effect of this antigen. This poison के effect को वो nullify कर देंगे. This is how it is going to work. So this type of antidotes are known as serological antidote. Now quickly let's see the another information on the antidotes. Now there was a concept of universal antidotes where we were using two parts of activated charcoal, one part of magnesium oxide and one part of tannic acid. So what they used to believe, toxicologists used to believe means this activated charcoal will help in physical absorption of drug. So it will take care of majority of poison substances. Yes, and this is true also. We are still using the activated charcoal. Then this magnesium oxide, it was thought to neutralize the acid and it was having property of laxative also. So it will neutralize all the acid, right? Remaining poison, charcoal is taking care. This magnesium oxide will take the care of acidic substances and it will, as a laxative effect, these poison substances will readily go out of our body. That's why they used to give the magnesium oxide, and one part of tannic acid. So this tannic acid now will precipitate the alkaloids and other heavy metals also like arsenic, iron and all. So, but later it was found that this tannic acid is having the hepatotoxicity. Now they are not used. This is called obsolete now. Now even magnesium oxide is also not being used. Even tannic acid is also not being used widely. What doctors are telling means activated charcoal alone is more effective. Now that's why they are only going with the activated charcoal. However, for exam point of view, it is important for us to remember what is universal antidote. So universal antidote is a combination of two parts of activated charcoal, one part of magnesium oxide and one part of tannic acid. Now let's see some another way to classify the antidote. So first is the specific antidote, means directly it will go with the poison, it will interact with the poison and it will counteract it. Example, pralidoxim in the OP poisoning or atropine in the OP poisoning. Directly going near OP poisoning, countering its activity. It's called specific, 1-to-1. Specific bole to 1-to-1. Then another आता है adjunctive antidote. So it is having indirect action. जैसे ऑक्सीजन इन कार्बन मोनोऑक्साइड पॉइजनिंग, कार्बन मोनोऑक्साइड की पॉइजनिंग हो गई है, वहां पे अगर हम ऑक्सीजन देंगे तो ऑक्सीजन सप्लीमेंटेशन को फैसिलिटेट करके आदमी की सर्वाइवेबिलिटी को बढ़ाएगा. हाउएवर इट इज नॉट गोइंग टू डू एनीथिंग विद द कार्बन मोनोऑक्साइड. सो दीज आर नोन एज एडजंक्ट एंटीडोट. अब थर्ड इज द ऑब्सोलेट एंटीडोट, जो पहले यूज होते थे. अब जैसे जैसे मेडिकल साइंस इज एडवांसिंग, वी आर नाउ नो लॉन्गर रिकमेंडिंग देम. एग्जाम्पल, इन यूनिवर्सल एंटीडोट we have given one example of magnesium oxide and tannic acid. So in the older days they used to be quite frequently used. Nowadays these two are removed, only activated charcoal we are using. Now this magnesium oxide and tannic acid are the obsolete antidote. So this is how we can classify the antidote, right? Now let's see how these antidotes work, right? How these antidotes work. Now first mechanism how this antidote works means, first is the inert complex formation. Once we are giving this antidote, they are going and forming the inert complex. Like poison and antidote we are giving, it is forming the inert complex. So example, arsenic is a heavy metal. British anti-levisite will go to the arsenic, it will bind and it will make a chelation compound that is inert in nature. Inert means it will not have any harmful effect to our body. So this is a first mechanism. Our second mechanism is accelerated detoxification. जो उसका detoxification process है उसको हम fast कर देंगे. Example, thiosulfate accelerate the conversion of cyanide into non-toxic thiocyanide. अगर किसी को cyanide poisoning हो गई है, so at that time what happen, if we will give the thiosulfate, this cyanide will react with thiosulfate and it will make thiocyanide. Now cyanide is harmful for our body, but thiocyanide is not harmful for our body. In that way we are detoxifying it. Now another example is acetylcysteine and paracetamol derivatives. अगर हम paracetamol का poisoning हो जाता है तो its derivative called NaPQI, it is having the toxic effect in our body. Now what this acetylcysteine is doing means, it is going and it is detoxifying the NaPQI. Now this NaPQI is detoxified, it is no longer available to show the effect in our body. Now our third type of mechanism how these antidotes are working is reduced toxic conversion. Now example, there is a methanol poisoning. In the methanol poisoning what happened, alcohol dehydrogenase will come and it will change this methanol into formic acid. Methanol itself is not harmful for our body, but this formic acid will go to our CNS and directly harm our neurons. And it will, in addition to that, it will inhibit the oxidative phosphorylation and generate a lot of lactic acid. That's called metabolic acidosis. In this condition what we will do, we will give ethanol. Ethanol बोले तो जो हम अल्कोहल दारू रहता है ना, तो that ethanol, now what happens means this alcohol dehydrogenase is having more affinity toward ethanol than methanol. Now instead of going alcohol dehydrogenase here for methanol metabolism, it will go for ethanol metabolism. Meantime what happened, this alcohol dehydrogenase is now not available for breakdown of methanol poisoning or metabolism of methanol poisoning. Now it is making complex with this. Toxic conversion इसका अब नहीं हो रहा है. So this mechanism is known as reduced toxic conversion, which is basically occur in the presence of enzyme. Right? Now another fourth type of mechanism is the receptor site competition, receptor side competition. So now let's see one example of opiate. किसी को अगर opiate की toxicity हुई है, so at that time what we'll give means we'll give one antidote like naloxone. What this naloxone will do, this naloxone will go to the opiate receptor. As it is having high affinity, it will go and bind the opiate receptor. जैसे मानो कि ये एक opiate receptor है, यहाँ पे opiate को आके अपना activity करना है. Now this naloxone will come and it will bind with this receptor. Now this receptor is no more available for the opiate. This opiate will simply roam in our body. After some time it will get eliminated from our kidney. Now this poisonous activity is reduced. This is called receptor side competition. This was enzyme side competition. This is receptor side competition. Hope we have understood this. Now our fifth mechanism is the रिसेप्टर साइड ब्लॉकेड. वहां पे क्या था, रिसेप्टर साइड कंपटीशन था, रिसेप्टर साइड ब्लॉकेड. फॉर एग्जांपल एसिटाइल कोलिन वी आर गिविंग if there is a organophosphate poisoning. Due to this acetylcholine, what is happening, this muscarinic and nicotinic receptor cholinergic activity is increasing, and if we are giving the atropine, this atropine is going and it is binding with the acetylcholine receptor. Now this acetylcholine is not able to work here. Rather than that, this atropine will reverse the action of this acetylcholine. So this is called receptor side blockade. It is completely blocking the activity of acetylcholine. This is called receptor side blockade. And our last mechanism is the toxic effect bypass, where we are bypassing the toxic effect of any poison. Example, if we will supply 100% of oxygen in the cyanide poisoning, what happens means this cyanide is having property कि it is blocking the supply of oxygen. Now what we are doing, it is blocking the supply of oxygen. We are giving the higher concentration of oxygen. After blocking the oxygen also, this oxygen is so much that it is going and doing its work. So we are bypassing the effect of cyanide. This is called toxic effect bypass type of mechanism. So these are the 6 different types of mechanisms involved in the antidote, functioning of antidote. So let's revise one by one. First is the inert complex formation. Second is the accelerated detoxification. Third is reduced toxic conversion. Fourth is receptor side competition. Fifth is receptor side blockade. And sixth is toxic effect bypass. Now, our last but very important type of principle involved in the management of poisoning is the nursing care and psychiatric care. Nursing care and psychiatric care. So, nursing care is required if a person is generally admitted in the hospital. This is very, very required, and required for educating also and for the follow-up also. Now, here some example I have given. This is a long list. Not only it does not end here, but it is a long list. Some of them I have listed here. So it needs to be kept in all the upcoming topics of toxicology. First is we have to give attention to the pressure point, and it will help in preventing the ulcers like bed sores. If we are not taking care of pressure points, it will lead to the ulcers. Some examples like bed sores and all. Then change of pillow and bed sheet, mattresses frequently. Then taking care of eye. Then urinal and fecal care. So all this comes under the nursing care. Then keeping the person in the left lateral position so that his secretions will go out of body and does not aspirate, causing aspiration pneumonia. Then suction and breathing exercises, chest exercises. Then passive physiotherapy for bringing the movement and all. Then drug and antibiotics if necessary. Administration of these components also will come under the nursing care. Similarly, taking good nursing care helps in the faster recovery. It will help in the faster recovery of patient. Now, similarly, let's see some type of psychiatric care. As we have discussed previously also, majority of these cases are suicidal in nature. People they want to end their life due to various problems in their life. Then in such cases, the psychiatric care plays an important role, right? So this counseling should be mandatory for all the poison cases, right? Let it be accidental, let it be intentional, or some other type of poison also. Our psychiatric care plays an important role. Now, the psychiatric counseling needs to be done to everyone, and they have to made aware about the importance of their life. Their psychoanalysis should be done. What is the current status of their psychiatric health, mental health? So that needs to be balanced. Then they have to given proper hope and all. Every life counts. They can do far better things in the life rather than ending their life. And then calling out them for the follow-ups. Then you just see adult and adolescents, the 78% cases, this is quoted from book only, 78% of poison cases were the intentional cases. They want to have a poison. So this is a large population, this can be countered. Then similarly, if a person is alcoholic, we have to counsel them about the health hazards of alcohols. If they are having chronic disease also, we should support them. Some people are having end stage cancers or some non-curable disease, means they want to end up their life, or sometimes it may be as a comorbidity also. So supporting them plays an important role. Then there may be financial troublesome, due to which they may thought of having the poisons. So again, these troubles needs to be sorted out. Then consult with the family physician if required, because they are more close with their family physicians, so they may give us better idea. Similarly, if someone is giving threat of suicide, we should take it very, very seriously. What data says कि 80% of suicidal patients have a history of threats, right? So जो भी सुसाइडल लोग हॉस्पिटल में आए, उनमें से 80% लोगों ने ये अटेम्प्ट करने से पहले ही घर में थ्रेट दिया हुआ, बताया हुआ है कि मैं सुसाइड करने जा रहा हूं, एंड पीपल हैव नॉट टेकन देम सीरियसली. सो नाउ इट्स हाई टाइम टू टेक द थ्रेट्स एज अ serious concern and working to educate them and counsel them and supporting them, right? So this is one very important highlight. All the toxicity cases needs to be consulted by the psychiatrist before they are getting discharged from the hospital. So this can prevent the relapse of poisoning event, and even this will help in coping with the stigma. Generally क्या होता है ना कि एक आदमी अगर intentionally poisoning करके वो बच भी गया, घर में जा रहा है, तो the society, the way family, the way society deals with them, it becomes a big stigma. So this stigma needs to be broken, and there requires the expert counseling by the psychiatrist. So all the poisoned person should be counseled by the expert counseling session of psychiatrist, right? With this we have completed our unit 1, that is the principle involved in the management of poisoning. So along with this, our chapter 1, 2, 3, 4, 5 are almost covered. So what are the remaining things we are going to discuss, and in the next class we are going to start the another chapter, that is chapter 6. So thank you for patiently listening for today's class, and if you are having any questions, any comments, any suggestions, any feedback, please feel free to write into the comment sections. And if you are having some friends in your circle, so you can share this video, this information with them also for better understanding. And the notes I am going to soon upload in my Telegram channel once the members are there. Thank you for listening to today's session.